Hello, it's Dr. Pat, and we have Lyle, a 9-month-old Panther Chameleon, with us today. And today we're going to discuss warning signs, what you should look for in your chameleon that may indicate a storm is brewing. This is very important. Chameleons don't show us a lot, and when they do show us a problem, they're usually crashing. Yes, there's a real syndrome, crashing chameleon syndrome. So to back up a little bit, chameleons require very specialized care. They're not a novice level reptile. You need to do thorough research and be experienced in caring for these animals, or be experienced in caring for reptiles before considering getting a chameleon. So these are rainforest animals in general. There's all different kinds of chameleons, but they require high humidity. They require a screened enclosure so the humidity doesn't get so high that we get fungal infections. They require basking temperatures and UV light. And these are all things that you should research and learn about to set them up appropriately long before you consider getting one. Let's talk about what to look for when you're looking at a chameleon. So when we look at Lyle here, you can see that both of his eyes are open, they're moving independently, and he has no abnormal swelling under his eyelids. If you have a chameleon that's squinting, one eye is closed, if there's any little lumps or bumps under the eyelids, or if he's not opening his eyes at all, that's an emergency. He needs to get checked out. If their eyes aren't opening, they're not going to eat, and it will progress very quickly. The other thing you should be aware of with your chameleon is if you do hold them, and I say if because we often recommend treating these guys like fish, not dogs. We reduce their stress by not handling them excessively. However, if you do get them out of the cage, if you're holding them, you should be aware of the grip. So they should have a very tight, very firm grip. Their little fingernails will actually hurt when they grip. And if they're not, if they feel a little weak, or if you see them moving around their enclosure and they may fall off a branch, or they're not moving at all, then again, they need to be seen right away. And then the other important thing is they actually project their tongue to eat. We've probably all seen this on cartoons. And so if they suddenly stop eating, or they're not projecting their tongue and actually catching prey appropriately, then again, this is an indication that we have a bigger problem and they need to be looked at. And so you may ask what that problem could be. The reality is it could be numerous things. They all show up with a similar presentation. So the most important thing is to get them to an exotic vet if something is abnormal or different from what you expect or what their routine is. The other thing to realize with chameleons is they actually form pretty much a symbiotic relationship with their plants. They must have living plants in their enclosure. It actually reduces their stress level, which enhances their immune response. So we do still see people come in with plastic plants in the cage. That won't cut it. We need to do better for these guys. You need to measure their humidity, measure their basking temperature and their temperature gradient. They should have a screen cage for airflow so we don't have too much moisture and the result can be fungal infections. Again, expert level care for these guys. Do your research, learn a lot. If you think you can provide their needs, then go out and get one. And the last thing is, if there's even something subtly different about your exotic pet, or certainly your chameleon, get them to your vet, ask them some questions. They're used to seeing a lot of changes that you may not have seen before, and hopefully can catch a problem and fix it very early on.